Hi, I'm Ed St. Jean, and my journey through the American healthcare system isn't just a story, it's a life lived and a battle fought. And there were some serious lessons that I had learned along the way. So 2 decades ago, a sudden health scare took me from an athletic young man, borderline invincible in my mind at the time, and suddenly I was facing a heart condition that no one saw coming. It was more than a physical challenge. It was a crash course in navigating a complex healthcare system, and there were some really pressing items that I was unaware of at the time. 28 days inpatient, a cardiac ablation to solve the arrhythmia. After the operation, I had a short strand of unsustained V-tachycardia, and it was facing a tough decision at that point. My choices were a lifetime of medication, said to make me fat, tired, and lethargic, life-altering, or I could receive a defibrillator and live what was said to be a normal rest of my life, just with the safety net in case the arrhythmia happened again. And at the time, the choice was easy to make. Little did I know, though, the harsh realities of America's for-profit healthcare system. Each step was a learning curve, teaching me the intricacies of a system that can be as daunting as the diseases it intends to cure. 20 years later, after the device designed to save my life with life-saving intervention nearly killed me, the lead had fractured, causing me to be shocked multiple times in error. The lead had also collected calcifications, which broke off and ended up in my lung as a pulmonary embolism. When reviewing providers, it was clear the recommended path of care was polarizing, even between top hospitals and top providers. I then found myself on an emergency medical flight to the Cleveland Clinic. This is the nation's top hospital for cardiac thoracic surgeries. You can imagine the sinking feeling in my gut when, after fully reviewing my medical history, they questioned why I had a defibrillator in the first place. They also took the time to explain that the medications used to provoke the arrhythmias in the cath lab are known to have lingering effects, so a short, unsustained VTAC is not uncommon. Needless to say, they performed a 14-hour surgery to extract the defibrillator and the lead. They artfully reconstructed my tricuspid valve in an effort to avoid a mechanical valve, because at such a young age, those mechanical valves really have about a 10-year lifespan. There is no question they provided both life-saving and life-altering care, and I am so grateful to God that I was able to be cared for by Dr. E and his whole surgical team. Today I stand before you not just as a survivor, but as an innovator. My journey through 2 decades of healthcare challenges has given me a very unique perspective. Today, we not only bring a framework that brings massive savings through a bottom-up approach, and it's important to note that this isn't about reducing costs. It's about reshaping healthcare experiences to be more individualized, efficient, and genuinely caring. With how complicated healthcare is, it's key to get it right from the get-go. Getting to the right provider delivers better health outcomes, reduced costs, and access to top-notch care is not just an ideal, it's a necessity. In my journey, the right support and care were not just beneficial, they were truly life-saving. And this is what we work to bring to you and your company. I want you to imagine a healthcare system where over-medication is not the norm, where primary care is not just a gateway, but a cornerstone to health. We are facing a healthcare crisis, not just in terms of the diseases we face, but in how we manage and approach them. 84% of primary care visits end in a new prescription being written today. The average length of these visits is only 8 minutes long nationally. This is a statistic that we desperately need to change. Big Pharma and the for-profit healthcare and insurance matrix are not being addressed by our leaders. It is your own action that is going to create positive change for your people, and we are committed to help. The key lies in informed, data-driven care management that not only guides your employees to the best care, but also engages them and helps them build understanding in the crucial role that they play in your benefit ecosystem. This is not just about healthcare. It's about a transformative approach that saves thousands of dollars for your company while ensuring the absolute best possible healthcare outcomes for your employees. This crafted formula, which aligns so well with my own 2 decades of expertise, is changing the game for our clients instantly. They see results with reduced premiums, healthier employees, and a more sustainable approach to healthcare. I want to invite you to click on the calendar link below and book a call to connect with me. I'm excited to share the secrets of this innovative approach with you and your company so you don't miss out on this opportunity. Together, we can redefine healthcare for your business, creating a healthier, more cost-effective future for you and your employees. Today is your chance to be part of a healthcare revolution to impact the lives of your incredible individual team and the families that you lead.